Chapter 15 Blood Full blood count. In the investigation of blood diseases, the simplest test is a full blood count. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, the volume of the cells, the erythrocyte sedimentation rate, a measurement of how quickly red blood cells fall to the bottom of a sample of blood. Anemia. Anemia is one of the commonest diseases of the blood. It might be due to bleeding, loss of blood, excessive destruction of red cell, low production, for example, because the diet is leaking, or deficient in iron. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor. Professor, what's the most likely diagnosis in this case? A student, most probably carcinoma of the bowel with chronic blood loss. Professor, what's against that as a diagnosis? A student, well, he hasn't had any change in his bowel habit or lost weight. Sorry. Professor, what else would you include in the differential diagnosis of severe anemia in a man of this age? Student, he might have leukemia of some sort or aplastic anemia, but that's rare. It will be very unusual. Another case is iron deficiency, but he seems to have an adequate diet. Professor, okay. Now, there's another case of anemia which I think is more likely. A student, chronic bleeding ulcer? Professor, yes, that's right. But what about pernicious anemia? Can you exclude that? Student, well, he's got none of the typical neurological symptoms, like paresthesia. Pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in his textbook. Pernicious anemia, PA, is a condition in which there is atrophy of the gastric mucosa with consequent failure of insect factor production and vitamin B12 malabsorption. The onset is insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to combination of pallor and milk jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red stone tone placidity is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. Onset, beginning, insidious, slowly developing, pallor, lack of color, mild, slight, jaundice, bilibinemia, breakdown, division into smaller parts, bone marrow, soft tissue in the cavity of bones, symmetrical, each side the same, vibration sense, ability to feel vibrations, progressive, continuing to develop, palpable, can be felt with the hand. Find words in the box with opposite meaning. Look at B and see opposite to help you. Adequate, against, unlike, severe, mild, rare, common, sudden, insidious, inadequate, for, likely. Make word combinations using a word from each box. Look at B and see opposite to help you. Bone, differential, insidious, iron, pernicious, progressively, vibration, diagnosis, sense, onset, marrow, increasing, deficiency, anemia. Complete the sentences. Look at A, B, and C opposite to help you. A 39 years old man presented by a history of abdominal distension over a period of 6 months. Blindness may be caused by vitamin A. The bleeding and purpura are caused by abnormal function. The white cell count is normal, so we can acute leukemia. The yellow color of her skin and conjunctivae is probably due to there was a mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with intravenous fluids. The anemia may be due to increased red cells. Complete the conversation. Look at the opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? Student, the problem started quite suddenly, so it didn't have the typical, he doesn't have any skin, and he doesn't have paresthesia or absent sense, and I couldn't fail his plan. Professor, what about his tongue? Student, his tongue was normal and not inflamed or